Today, we're diving into a quest that really defines modern medicine. It's the search for the perfect weapon to fight disease.
What if we had a weapon so precise it could hunt down a disease inside your body without touching a single healthy cell? I mean, just think about that for a second. It sounds like something straight out of science fiction, right? But it's actually a dream that scientists have been chasing for more than 100 years. For over a century, medicine has been on the hunt for these so-called magic bullets. And today, well, that chase is over. We have them. They're in our hands. They're called antibodies. And this is the incredible story of how we learn to command them.
So, our story doesn't really begin with a discovery. It starts with a dream. The dream of a perfect targeted therapy, a magic bullet.
Okay, so what exactly is the hero of our story? An antibody. You can think of it as your body's own personal, highly specialized security force. It's this tiny little protein that your immune system makes, and it has just one job: find the bad guy, a virus, bacteria, whatever, and take it out. The real revolution, the whole point of this story, started when scientists figured out, hey, wait a minute, maybe we can harness these natural defenders, turning them into powerful therapies. This explainer is all about that incredible journey, from discovery to design.
Now, the first attempt at using this power was, well, let's just say it was a little bit crude. The whole idea was about borrowing immunity from someone or, something else.
So picture this. It's the 1890s. Scientists realized they could take blood serum, which is just packed with antibodies from an animal that had already recovered from a disease, and inject it into a person who was sick. And by 1898, companies like Park Davis and Company were already cranking out these new therapies.
And listen, this was absolutely revolutionary. All of a sudden, we had treatments for deadly diseases like diphtheria and tetanus. But, and this is a big but, they were far from perfect. Because these serums were kind of a mixed bag of animal proteins, they often caused really serious side effects in patients. So they were powerful for sure, but they were a blunt instrument. So while one group was trying to borrow immunity, another, much more elegant strategy was starting to take shape. People started asking, what if you could just teach the body to build its own defenses?
And that right there, that's the fundamental idea behind vaccination. Instead of getting a temporary fix from some borrowed source, what if you could just trigger the body's own immune system to create a permanent, personal army of antibodies? This really created two totally different paths. On one hand, you had serum therapy, which gives you passive immunity. You get the ready-made antibodies, so it works right away, but it wears off. Then you've got vaccines, which create active immunity. They teach your body how to do the work itself for long-term, lasting protection.
And the impact of this self-made immunity strategy? I mean, wow, it has been nothing short of profound. It's the whole reason smallpox doesn't exist in the wild anymore, and why so many diseases that used to be terrifying are now totally preventable.
So for decades, these two paths, serums and vaccines, were basically the main tools in the toolbox. But then, a massive breakthrough happened. The true magic bullet was finally about to arrive.
The 1980s. This is when the game completely changed. Scientists finally figured out how to manufacture what are called monoclonal antibodies. Monoclonal just means they all come from a single cloned cell, so every single one is a perfect, identical copy. These weren't harvested from animals. They were pure, engineered weapons, each designed for one specific target. Just look at the incredible leap we made here. We went from a messy mix of proteins from an animal to a pure, uniform weapon built in a lab. This was it. Highly specific, precisely targeted. The magic bullet wasn't just a dream anymore.
But here's the crazy part. This breakthrough didn't just stay in high-tech labs. It quietly worked its way into our everyday lives, ending up in places you'd probably never expect. Like, say, your bathroom cabinet.
Because here's the thing about antibodies. If something is really great at finding a specific target to attack it, it's also really great at just finding that target to tell you it's there. And this unlocked a whole new world of diagnostics. You know, this idea of using antibodies for detection wasn't totally brand new. The basic principle actually goes all the way back to the early 20th century, with the very first tests for diseases like typhoid and syphilis. But now, with these monoclonal antibodies, it became incredibly simple, fast, and accurate. That amazing technology is exactly what powers the modern home pregnancy test, a true magic bullet, right there in your hand.
So, when we step back and look at the whole picture, this century-long quest has left us with an incredible legacy of innovation that touches pretty much every part of our health. And this legacy is really built on three main pillars. You've got therapy, with these powerful drugs that hunt down everything from cancer to autoimmune diseases. You've got prevention, with vaccines that train our bodies to defend themselves. And then there's diagnostics, which gives us fast, accurate answers about our health. I mean, it's pretty amazing. What started as a kind of crude attempt to borrow immunity from animals has evolved into the absolute peak of precision medicine. This journey hasn't just changed healthcare, it's completely reshaped how we experience being sick and being healthy. And all of that leaves us with a really fascinating question for the future. We've spent more than 100 years building this unbelievable weapon. So now that the magic bullet is real, what should we aim it at next?